HIV/AIDS and sexually transmitted infections or STIs continue to be major public health challenges in the Philippines and worldwide. Despite advances in medicine, prevention and education remain critical because the disease affects not only physical health, but also emotional, social, and economic well being. In the Philippines, the Department of Health implements the National HIV and AIDS Prevention under the Republic Act 11166, also known as the Philippine HIV and AIDS Policy Act of 2018. This law focuses on preventing transmission, ensuring access to treatment, and protecting the rights of people living with HIV. As we address HIV/AIDS, this requires a population focused approach, one that considers not just clinical management, but also behavioral, cultural, and policy factors. Our role as nurses extend beyond treatment. It is about education, empathy, and empowerment. The Philippines currently has one of the fastest growing HIV epidemics in Asia, according to WHO and UNAIDS. Most new infections occur among males aged 15 to 34 years, particularly in key populations such as men who have sex with men or MSM, transgender women, and people who inject drugs. The challenge is not only the rising number of cases, but also the late diagnosis of many individuals. Many are unaware of their status until the disease has already progressed. Compounding the problem is stigma and discrimination, which discourage people from seeking testing and treatment. This is why nurses must be both educators and advocates, helping normalize conversations about sexual health, promoting testing, and protecting patients' confidentiality and dignity. HIV or human immunodeficiency virus is transmitted primarily through unprotected sexual contact, sharing of contaminated needles, and mother to child transmission during pregnancy, childbirth, or breastfeeding. Less common modes include blood transfusions, though these have become rare due to strict screening protocols. It is also important to remember that STIs such as gonorrhea, chlamydia, and syphilis increase the risk of HIV transmission. These infections cause lesions or inflammation, making it easier for HIV to enter the bloodstream. Prevention in public health nursing focuses on reducing exposure and strengthening protective behaviors. meaning we must teach communities about safe practices and regular health screenings. In the early stage of HIV infection, symptoms are often mild or flu like. Example is fever, rash, swollen lymph nodes, and fatigue. Because these are non-specific, many people dismiss them and fail to get tested. As the disease progresses to advanced stages, the immune system weakens, leading to opportunistic infections such as tuberculosis, pneumonia, or oral thrush. Significant weight loss, night sweats, and persistent diarrhea are also common indicators. Many individuals remain asymptomatic for years, which underscores the need for routine testing and risk assessment, even in the absence of visible symptoms. Our role as nurses is to emphasize that early detection leads to early treatment and a longer, healthier life. Diagnosis begins with VCT, or voluntary counseling and testing, or through community based screening. Testing is confidential and always accompanied by pre and post test counseling, ensuring clients are emotionally and mentally supported regardless of the result. Once diagnosed, clients are immediately started on ART or antiretroviral therapy, a combination of drugs that suppress viral replication and allow the immune system to recover. Consistent ART use ensures viral suppression, meaning the virus becomes undetectable, and undetectable equals untransmittable. Regular follow up visits, laboratory monitoring, and adherence counseling are crucial to achieving treatment success. As nurses, we must build trust and encourage patients to stay on treatment, even when they feel well. HIV and STI prevention rests on both behavioral change and accessibility of services. The DOH emphasizes the promotion of safe sex practices, including consistent condom use and reduction of high risk behaviors. Routine HIV testing and early initiation of ART are central strategies under the national program. Additionally, targeted interventions are designed for key populations, such as for those men having sex with men, sex workers, person deprived of liberty, and overseas Filipino workers through outreach, counseling, and peer education. From a community health nursing perspective, prevention also involves empowering individuals to make informed, responsible decisions about their health and relationships. Health education is one of the most powerful roles we play as nurses. We advocate for responsible sexual behavior, self awareness, and early consultation for any suspected STI symptoms. We must also address myths and misconceptions surrounding HIV. For instance, some people still believe HIV can spread through casual contact, which is false. By providing factual information, nurses help reduce stigma and fear that prevent people from seeking help. Equally important is the promotion of confidentiality, respect, and compassionate care. Effective health education involves cultural sensitivity and empowerment. That is, meeting people where they are without judgment. The role of the public health nurse in the HIV, AIDS, and STI program is both clinical and social. We facilitate counseling, testing, and referral to treatment hubs. We ensure that clients are emotionally supported throughout the process. We also lead community education campaigns, spreading awareness through health fairs, youth forums, and school based sessions. Public health nurses coordinate with NGOs, community based organizations, and treatment hubs to expand outreach and ensure linkage to care. In short, we are not just providers of care, we are advocates, counselors, and educators who uphold both health and human rights. To recap, HIV and STI prevention require both medical and social interventions. Medication and testing alone are not enough. Addressing stigma, misinformation, and barriers to care is equally essential. We nurses play a key role in education, advocacy, and patient support, guiding individuals toward healthier decisions and connecting them to services. When communities are informed and empowered, prevention becomes everyone's responsibility. As public health nurses, we carry this mission forward, ensuring that every Filipino, regardless of background, has access to knowledge, compassion, and care. Together, we move closer to the vision of a Philippine free from HIV related stigma and discrimination.